Hello there, my name is Savula Stiliano and I'm the Communications and Events Coordinator for SEMA. Welcome to our series of interviews with our 2021 Innovation Fund Award winners. Can you please introduce yourself?
Yes, hi, I'm Dr. Karen Yeates, and I'm a professor in the Department of Medicine in the Faculty of Health Sciences.
Great. And did you apply to the competition this year as an early or established investigator?
I applied as an established investigator, but I have team members who are early career investigators.
Wonderful. And can you tell me about your proposed area of research, including the title and how long the project is estimated to take?
Yeah, sure. So our title for this SEMO grant is called Listening to Our Elders, Using Concept Mapping and Digital Storytelling to Understand and Integrate Resilience and Wellness into Community and Health-Based System Approaches for the Prevention and Treatment of Diabetes in Remote Indigenous Communities. It's a long title, but we wanted to try to capture the essence of what our sort of research efforts are going to be.
Very exciting. And what does receiving the Innovation Fund Award mean for you?
So getting this award is actually critical, and it's coming at a really good time. Through the pandemic, I've been able to luckily spend more time providing healthcare in the Winnebago Area Health Authority communities on the Western James Bay coast, where I actually look after our dialysis, our hemodialysis program, which has been there for quite some time, as well as looking after kidney patients. But I've also been able to have that time to work with research colleagues and partners in Winnebago, primarily based in Moose Factory, where the main hospital and the research group is based. And, we've been able to, along with other colleagues from Queens who provide diabetes care in the communities up in the Waha, we've asked some questions and discussed some pathways to potential solutions. So one of our big challenges for us as specialists who work, provide virtual care or fly in and out of the communities is that, in between our visits and compounded by the pandemic, it can be very challenging to have ongoing continuity of care for patients. And also, I think like liaising and collaborating with their primary care team and allied health members of that team, as well as physicians. And although there's lots of virtual tools available to us, it can be really challenging to implement those in those settings to really support patient care. And so we kind of started thinking about some Indigenous, more Indigenous specific community needs and perspectives on how perhaps virtual tools or mobile health tools, sort of computer-based platforms could be used to link patients with caregivers and improve communication between the whole healthcare team, and also to support patients in their own self-care and management of chronic diseases such as diabetes. So as we started to look at some of the programs that are out there and look at what potential solutions might be, we actually came up with more and more questions by taking a step back and thinking what would be the most appropriate and culturally safe and acceptable ways that we should or could be providing improved virtual care, improved patient communication, improved patient support if we were to do that using some digital health tools. So instead of trying to come up with our own solutions or implementing or just taking solutions that might be off the shelf from a digital technology perspective, we wanted to take a step back and work together as healthcare providers and researchers to think of how we could maybe use existing solutions, but adapt them to work in ways that patients and health providers in that specific type of setting could benefit from in different ways. So thinking about what is person-centered care for Indigenous individuals and their families and communities, that may be quite different than what we consider in our like tertiary academic healthcare center and programs here in Kingston. So as we started thinking about questions or how we could try to improve care in many ways and patient support and continuity, we actually started developing more questions, which we agreed that we should take a step back and kind of start with those questions first and then move forward. And in the title, we had listening to our elders, because a lot of the care that I provide and that my colleagues here at Queen's provide often is caring for elders in the communities because of the prevalence of the burden of chronic disease that many elders have. So that listening to them, especially from a virtual care or a mobile healthcare perspective, we felt was really important to see how there could be ways that if we could develop systems or programs that would serve them, then that would be probably, they would be solutions that would work for most of the population within these communities, thinking about, digital literacy or access to these types of platforms, access to the internet or Wi-Fi or having a cell phone, this kind of thing. So yeah, that's kind of where it started. And yeah, we are just embarking on that process. And we hope that, as we speak with, community members, with health providers, with other people involved in the health system, and of course, patients, individuals and their families who are part of the circle of care and supporting people, we're hoping that will help us to together come up with what I consider sort of community informed solutions for how we could improve the way we deliver care and support.
That's wonderful. Thank you so much for your time today, Dr. Yeates. For more information on the Innovation Fund, please visit the CIMA website.
Thank you.